Now, the Minister of State for Health, Social Welfare, Dr. Isiaq Salako, has revealed that plans have been finalized to establish and upgrade 6 federal teaching hospitals. Dr. Salako says this will be done with new radiotherapy and nuclear medicine facilities across the country, with 3 centers set to be commissioned in May 2025 and the rest before the 2026 World Cancer Day.
To raise awareness about cancer prevention, detection and treatment, with a global push to reduce the impact of the disease. To beat cancer, these experts here say it will take combined efforts through raising awareness and improving prevention techniques through vaccination, early detection, prompt treatment and research.
While the vaccination for the viral hepatitis has been on the National Program on Immunization, HP vaccination was commenced in 2023, and it is heartwarming to know that we have successfully immunized over 12 million girls for human papillomavirus virus, and effort is ongoing to improve on the successes recorded so far.
We should not focus just on treating the disease, but we should adopt perspective and experience of individuals, carers, families, and communities.
One of the major areas of disease management, including cancer care, is in the area of nuclear medicine services, which Nigeria lacks. But to change the tide, the ministry is now inaugurating a 35-member nuclear medicine technical working group to spearhead the management of cancers and other diseases.
That while our experiences and challenges may differ, our goal remains the same: ensuring equitable access to cancer prevention, early diagnosis, treatment, and care for all Nigerians.
As a country, we developed a very robust initiative, including partnering with the International Atomic Energy Agency, to develop nuclear medicine program in Nigeria. The National Nuclear Medicine Management Committee that was set up by the ministry in 2010 did their best and facilitated training of several nuclear medicine physicians and other allied health care professionals.
The Minister of State, as well as other experts here, agree that although the present administration has made substantial investment in cancer prevention and care within the last 18 months, a lot
more in August 2016. So I started checking after examinations. I was told in March 2017 that the tumor is cancerous, and that was how the journey started. And it has not been an easy journey. Yes, I have done 8 sessions of chemotherapy. I have done 25 sessions of radiotherapy. I've been on hormonal therapy. Now I am on targeted therapy. So it just keeps going and going and going. And like the theme of the World Cancer Day this year, United by Unique, every cancer patient has their own journey. You know, there's nobody that has, no 2 persons has the same story. No 2 persons has, they might have similar outcomes, but different stories. So for me, I just tell people I've been fighting for the past 8 years. I mean, literally fighting for the past 8 years. But I'm grateful to God that I'm still here. And you asked how I survived.
Yeah.
Yes. Besides trying to do what the doctor asked me to do, being very vocal has helped me a lot. Talking about my challenges has helped me. And I started doing that because I identified a gap in the system where patients do not talk. There was so much silence and stigma, and people just want to hide away from their reality. And it was not helping other patients coming behind, because people were likely to know someone that died from cancer than someone that has survived cancer. So where did they build the grit to fight if they are diagnosed? Yes. So because I didn't see anyone to talk to, for the first 2 years, I made mistakes, and I made up my mind I was going to be vocal about my journey. I was going to talk to people. and I was going to make sure they have a face to identify with survivorship that is actually black and Nigerian. Because when the doctor said to me, "Oh, madam, this thing in your breast looks like cancer, and if it's cancer, we'll chop off your breast." That was the way he said it to me. What came to my mind was the white women I had watched in movies diagnosed with cancer. And the usual line is, "Oh, I'm dying." And they're like, "Oh, do you have cancer?" I say, "Yes." And then the next thing, the person is pale, the hair is gone, and then the person dies. I've not seen anyone survive cancer in movies. And I didn't know people that have survived physically when I was diagnosed. So I made up my mind to be vocal and put my story and my picture out there to encourage other people. And that is a form of healing for me as well. Because when people say to me, "I saw your story online, it encouraged me. My sister saw your picture online, it encouraged her." It feels like I'm doing something good with such a horrible disease. And that is happiness for me. And I ask for help. The worst I can get is a no. Nobody's going to beat me for saying, "Help me." So I ask for help, emotional support, psychological support, financial support. Anytime I need help, I tell people what I need. And honestly, I have the best support system in the world. Yes, they may not have all the money to give me all the times, but they are always available.
Okay, so
these are some of the ways I've been surviving.
Interesting. It's just a very touching story, I must say. I'm going to be asking you two questions in one.
Okay.
One is there any time there was a God factor in it? Second is, how can we manage cancer in Nigeria?
Yeah, there was a God factor. Okay, I would say when I heard the news, my whole world crashed. But at a point, I picked up my faith and said, "I'll beat this, I'll fight it." But I think at a point, I removed the God factor. I became very angry, like most young cancer patients are actually very angry. You do not know until you speak to them.
Yeah.
When the cancer returned in 2022, I removed the God factor. I became very angry. I became inconsolable because I had so much faith that after doing everything I was asked to do, I was going to be fine and I was done with cancer. So when it came back, I said, God is not listening. God is not here. So I became very, 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 very angry. But eventually I'm getting back to that place where I've told myself, no matter what happens, there is God. Because no matter how angry I was, I've never been able to convince myself that God does not exist. If I had, maybe I would have moved on from my faith, but deep down in my heart, I know that God exists. And every day I see God in the faces of kind people, good people, people that call me and say, "Hey, hang in there." I know that is God. Because once most of those calls come in, I'm always really, really down. So how do they know that I'm so down? And they call to say, "Hey, hang in there." Okay, "Hey, I'm sending you a bowl of soup. Hey, I'm taking you out tonight for dinner. Let's go do karaoke."
Yeah.
I know that is God trying to give me faith.
Exactly.
And throughout my journey, there's no time what I earn would have been able to pay for my treatment. But people keep coming through. So it's God that doesn't want me to die yet.
Exactly.
So I see God every day in my journey, and I've come to terms with the fact that God is here. Even though He has not done what I want to do, which is a miracle to just remove cancer, but He's here.
Okay. He will do it.
Yes.
Yeah, but
the second
question.
Yeah, for the second question, we still have a long way to go in Nigeria. Even though we are not where we were before, there was a time we had no working radiotherapy machines in Nigeria. When I was diagnosed, there was no working radio machines anywhere in Nigeria. Today, it's not the same story.
Yeah.
Yes, and today, patients come out to share their stories. Patients have become experts that support to do research, and a lot of things are changing. But there's still a very, very long way to go because the average Nigerian still pay out of pocket to treat cancer, and that runs into millions. I've never sat down any day to calculate how much I've spent because I know it will drive me crazy. The millions that have gone down these 8 years, I don't want to think about it. And some people were not lucky to have people to support them or get any form of government funding, and they died. They wanted to leave, but because of no money, they died. So we really have to pay attention to financing and financing cancer care. Universal health coverage, NHIA, the Cancer Health Fund, which luckily has been helping, a lot of patients, myself inclusive. I'm benefiting from the Cancer Health Fund. But for now, it covers only 3 diseases, only 3 cancers, and only 6 health centers. The government has promised to expand it, has promised to expand, the people it covers as well. And we hope they do that quickly. If there is money to treat cancer, part of the fear and the tension that comes with the bad news will be greatly reduced. We'll have better outcomes. And also focus on infrastructure. Let us have the machines working. Let us have our workforce well paid, well motivated. If I have to see my doctor now, I have to stay for almost a month. I have to book because she has so many people on the queue that she can't take them in a day. But if I had enough doctors, that would not be the case. I can just walk in and see my oncologist. So infrastructure, motivated and well-paid workforce so that the Japa syndrome stops. And then we should improve universal health funding. And of course, pay attention to psychological support for patients.
I think that's very important.
So patients die from depression, die from panic attacks, from anxiety, just at the sound of cancer. So it's important that they are prepared mentally also for the journey ahead. I
think that's very, very important. There was something that you mentioned, and that has to do with finances.
Yes.
And you look at, for example, your organization organized a symposium on the hardship being faced by cancer patients in Nigeria. How do you intend to raise the support or funds for this kind of event? And how do you think that the Nigerian government need to? What are the channels they need to pass through to get funds, down to the patients, and how they can be able to fund all of this stuff?
Okay, as an organization, we did little we can do. Unfortunately, no funder wants to give you money to fund treatment. We've tried a lot of times. No funder wants to give you money. They will give money for research. They will pay for training oncologists. They feel those ones are more sustainable than paying for treatment. They want the government to pay for treatment of their patients or something. So sometimes we do fundraising for patients, and honestly, these days we are not able to raise any good amount of money. And as a cancer patient, it gets to me because we have to put these people's faces out there. At the end of the day, you raise money that cannot even do 1 chemo for them. We know how much we convince them, to bring your picture so that people will believe our story. When you're not sure you can even raise a quarter of the millions they need. So it's becoming more challenging with the harsh economic realities for us to raise funds. But every December, my executive director, Mr. Ron CCW Chidebe, his birthday is on 26 December. So every 26 December, he raises money for 2 cancer patients. Money for gifts, he asks people to just send it to a GoFundMe and shares it for 2 cancer patients. Sometimes we have people that are working and say, I'm donating this amount. We give to the patients that are available. These are the little ways we do. But because we know we cannot sustain, how many patients can we fund with these little initiatives? So that's why we're hitting on the government. They have the capacity. Through the Cancer Health Fund, if they can mobilize the private sector, the government cannot do it alone because the cost of treating cancer is too much, about 20 million to treat breast cancer.
And you did 8 chemo?
Yes.
Wow, interesting. Yes.
So you will need up to 20 million to treat breast cancer in Nigeria today. So imagine how many patients we have in Nigeria. So we need the private sector, to be co-opted into the Cancer Health Fund. They should give back. Let it be a way of giving back so that there are funds there to just keep, disbursing to the patients that cannot afford it. Because even that 20 million, some people can afford it. The indigent patients that cannot. we find ways to support them. Even if we can't pay all, we should pay a huge percentage, and then they can look for support elsewhere. So that's why we are emphasizing on the Cancer Health Fund. It's working actually now. It's already working. But there are still some rough edges we are hoping that the government will fix, especially with bringing in people that will fund and sustain it.